after Dr. Fauci, we'll be hearing from three pediatricians who each bring a different perspective. One with the Centers for Disease Control and Prevention, one the Director of the Office of Minority Health at the Department of Health and Human Services, and the last is the President of the American Academy of Pediatrics. Once you've heard briefly from each of these doctors, we will take your questions through the webinar Q&A function. And so not the chat area, specifically through the Q&A function. And be sure to add your questions as we go into this feature. We'll try to answer as many as we can to make sure that we can, and our goal is to get to as many questions that haven't been addressed by previous speakers. Keep in mind that we'll need to see your question in English, but they will be translated when we respond. And so with that, Dr. Fauci, we'll welcome you to kick us off.
Thank you very much, Dr. Webb, and warm greetings to everyone. I would like to provide a very quick snapshot, first of the COVID-19 pandemic in this country, and then talk a bit about the exciting and important recent news that COVID vaccines for kids aged 6 months through 5 years are now authorized, recommended, and are available. As you know, currently there's about 100,000 new cases of COVID are being reported each day in the United States, of which around 1 in 8 are among children. These remain large and concerning numbers, but case counts have dropped dramatically from the peaks that we saw in January when we had more than 800,000 cases each day. While COVID hospitalizations have declined substantially as well, they still are at an unacceptably high level. About 4,700 people are hospitalized each day, including, unfortunately, 240 children. COVID deaths are also down significantly, yet about 250 to 270 people still die each day from COVID. And so clearly COVID is not over. However, we've made great progress. More than 220 million Americans are fully vaccinated, and 100 million people have received a booster shot. And we've moved quickly to ensure other life-saving tools, including treatments such as Paxlovid, which are now widely available. Among this progress, we sometimes overlook COVID's impact on the health of children in our country. More than 13 million children have been diagnosed with COVID, 2.5 million of them under the age of 5 years, and more than 133,000 children have been hospitalized with COVID. And tragically, more than 1,500 children with COVID have died, including 490 under the age of 5. Moreover, more than 8,500 children with COVID have been diagnosed with MIS-C, an inflammatory condition that may affect the heart, lungs, kidney, brain, skin, eyes, or GI tract. Additionally, just like adults, children can develop persistent symptoms called long COVID. Among these sobering statistics, the news of vaccines being available to protect the youngest members of our community is so welcome. Recently, as you know, the FDA authorized and a CDC advisory committee voted unanimously to recommend 2 COVID vaccine regimens: a 2-dose primary series of the Moderna vaccine for children 6 months to 5 years, and a 3-dose primary series of the Pfizer vaccine for children 6 months to 4 years. These authorizations expand the eligibility for COVID vaccination to nearly 20 million additional children. All Americans aged 6 months and older are now eligible for vaccine. Let me quickly summarize the efficacy and safety data on the 2 vaccines that were gleaned from rigorous randomized placebo-controlled clinical studies, which is the gold standard in medicine. The Moderna vaccine was tested in about 6,400 children and infants. Their immune responses were comparable to those of young adults vaccinated with a higher dose that was determined to be effective clinically. Side effects of the vaccine were mostly mild to moderate and transient, and were consistent with those seen with other recommended vaccines for this age group. Importantly, no cases of myocarditis or MIS-C were reported. The Pfizer vaccine was evaluated in about 4,500 children and infants. Again, their immune responses were comparable to those of young adults vaccinated with a higher dose, again, that was determined to be effective clinically. And similarly, side effects were mostly mild to moderate, transient, and similar to those seen with other recommended vaccines. No myocarditis or MIS-C was reported. The bottom line is that the known and potential benefits of these vaccines outweigh the known and potential risks in children. And so patients and caregivers can be reassured that all children over 6 months of age, including children who have already had COVID, can now be protected through vaccination. This week, distribution of pediatric vaccines for the very youngest children has been started across the country at thousands of pediatric medical practices, pharmacies, federal qualified health centers, local health departments, clinics, and other locations. Children in this younger group can be vaccinated with whichever vaccine is available to them, either Moderna or Pfizer. I encourage you to talk with your child's healthcare provider about COVID-19 vaccines. Parents and caregivers can reach out to their physician, nurse, pharmacy, or health department, or you can visit vaccines.gov to see where vaccines for children are available locally. This is a moment of celebration for parents and families and a historic milestone for our country. I look forward to your questions at the end of this session. Thank you, and back to you, Dr. Webb.
Thank you so much, Dr. Fauci. And as always, you've definitely helped make a lot of this much more clear. I want to pivot to our next panelist. We have Dr. Kevin Chatham-Stevens, who's a pediatrician at the Centers for Disease Control and Prevention. He's currently serving as CDC's pediatric COVID-19 vaccine planning and implementation lead. And that makes him the perfect person to explain how these vaccines will be available to our younger children, really building on Dr. Fauci's point. So I'll pass it to you, Dr. Chatham-Stevens.
Great. Thank you so much. And really appreciate the opportunity to chat with you all today and explain some of the planning efforts that have gone into making this vaccine program as successful as possible. And, I just wanted to start off by saying, we heard Dr. Fauci describe the tragic toll that COVID-19 has had on younger children. As a pediatrician and as a parent, those numbers are definitely difficult to hear. But they do convey that COVID-19 can cause severe disease and death among children, including children without underlying medical conditions. And we anticipate that future surges will continue to impact children, with unvaccinated children remaining at higher risk of severe outcomes. So COVID-19 vaccination for younger children is really a critical opportunity to prevent severe illness, especially among those disproportionately impacted by COVID-19, including those from certain racial and ethnic minority groups, and children with underlying medical conditions, disabilities, or special healthcare needs. And as Dr. Fauci mentioned, fortunately now we have 2 vaccines available for younger children. And because of the slight differences between the 2, we always like to reiterate the differences. So the Moderna vaccine is for children 6 months through 5 years old and is a 2-dose series. The Pfizer BioNTech vaccine is for children 6 months through 4 years old and is a 3-dose series. Children get an age-appropriate, smaller dose with each of these vaccines compared to doses given to older children. So now that these vaccines are recommended, what are we doing to ensure they're widely available? Our goal with this vaccine program is to make sure that all children have access to this vaccine. Similar to the vaccine program for children 5 to 11 years old, we're working to ensure vaccine for children under 5 years old is widely available in different locations throughout communities, really trying to meet children and families where they are as much as possible. However, there will be some key differences between this vaccine program and the vaccine program for children 5 to 11 years old. For example, about 33% of 5 to 11-year-olds were vaccinated in pharmacies. We anticipate that most children under 5 years old will be vaccinated in their primary care clinic. So pediatricians, family practice doctors, and nurses in local health departments, especially those in rural areas, Indian Health Service and tribal health clinics, and federally qualified health centers and rural health clinics will continue to serve critical roles in contributing to vaccine equity. We know that pediatricians, family practice doctors, nurses, and other clinicians are often the most trusted sources of information for families and can really help answer any of those potentially difficult questions that families have regarding the vaccines. And getting COVID-19 vaccines in doctors' offices is really optimal, since it also enables children to receive routine childhood vaccines, screenings for a variety of issues, including developmental and vision screening, and also families and children to get counseling on a variety of topics, such as nutrition and injury prevention, that help children thrive in a safe environment. We do still anticipate that pharmacies will play a critical role, for example, in having vaccine available at nights, on weekends, and on holidays when clinics may be closed. And in addition to the doctors, nurses, pharmacists, and others who will be vaccinating children, we anticipate that settings such as child care programs like Head Start and other support programs like WIC will be critical partners in helping disseminate messaging on the vaccine, given their roles as trusted messengers to families. They can also help link children to vaccine providers, which many already do for routine childhood vaccines. In addition, some child care programs may decide to partner with a vaccine provider, such as a local pediatric clinic or health department, to coordinate a vaccination clinic for their children, similar to how some schools have hosted vaccination clinics for 5 to 11-year-olds and adolescents. So for those child care programs, schools, community-based organizations, faith-based organizations, and others that are working on COVID-19 vaccine activities, there are some strategies to consider for increasing vaccine access and demand, including partnering with the local health department, pediatric clinic, children's hospital, or pharmacy to host vaccination clinics, providing safe spaces for parents to ask questions about COVID-19 vaccines, such as town halls, parent meetings, and one-on-one conversations, recruiting vaccine champions from the community to share testimonials with parents, such as doctors and teachers, nurses, and sports coaches, and offering frequent and culturally appropriate communication about COVID-19 vaccines. To help support these communication, CDC and other partners have a variety of resources available. For example, we recently posted a website for providers on vaccinating children with disabilities, which lists some strategies providers can implement to make vaccination settings as welcoming as possible to children with disabilities. There's also a parent-oriented webpage on vaccinating children with disabilities. We also have a quick conversation guide that helps empower clinicians to answer questions that parents and caregivers may have about the vaccines. We're also working on various materials for this summer that will remind clinicians and families to incorporate COVID-19 vaccines and routine childhood vaccines into any back-to-school visits. In addition, we have fact sheets available in a variety of languages, including Amharic, Arabic, Chinese, French, Korean, Portuguese, Spanish, and Vietnamese. And many of our partners, such as AAP and the National Resource Center for Refugees, Immigrants, and Migrants, also have a variety of great resources available, including fact sheets, videos, toolkits, and conversation guides. And just a reminder about vaccines.gov, which enables the public to identify nearby providers with available vaccine and learn how to make an appointment. You can now use vaccines.gov to search for providers offering vaccines for children under 5 years old, and also see the minimum age that can be vaccinated at a particular location. For example, many pharmacies will only vaccinate children 3 years and older. In addition to vaccines.gov, we encourage parents and caregivers to reach out to their child's pediatrician or family practice doctor, their local health department, pharmacy, and other healthcare providers to ask if they have the vaccine. And parents and caregivers are also encouraged to register their children for VSafe to share how their child is feeling after vaccination. VSafe uses confidential text messaging and web surveys to provide personalized health check-ins following COVID-19 vaccination. So once again, just to finish up, COVID-19 can cause severe disease and death among children, and COVID-19 vaccination for younger children is a critical opportunity to prevent severe illness. Thank you very much.
Thank you very much, Dr. Chad Stevens, both for your remarks and also for all you've done at CDC to make sure that these vaccines are getting exactly where they need to be for kids to be vaccinated, and particularly these youngest children here in our country. Next, we'll hear from Rear Admiral Felicia Collins. Dr. Collins is the Deputy Assistant Secretary for Minority Health and Director of the HHS Office of Minority Health. She leads the Office of Minority Health in its mission of improving the health of racial and ethnic minority populations through the development of health policies and programs that help eliminate health disparities. Dr. Collins is a pediatrician. She has more than 20 years of federal service working to improve the health of vulnerable and underserved communities. Dr. Collins, over to you.
Thank you so much, Dr. Webb. Hello, everyone, and thank you for joining today's event. Again, my name is Dr. Felicia Collins, and I have the honor of serving as the Deputy Assistant Secretary for Minority Health within the Department of Health and Human Services and the director of the department's Office of Minority Health. As was mentioned, the Office of Minority Health is focused on helping to reduce differences in health outcomes or health disparities for racial and ethnic minority and American Indian and Alaska Native communities. On a personal level, as was noted, I'm also a pediatrician, and I describe myself as a pediatrician by training and a public health practitioner at heart. And I really have focused my career on addressing health disparities experienced by racial and ethnic minorities, children, and other underserved and vulnerable populations. Thus, it's a real treat for me to be here with you today to help spread the message of the importance of COVID-19 vaccination for all children, including our youngest. Now, we understand that parents have questions about getting their children vaccinated, and that's why we've come together today to answer questions, to share accurate and current information on COVID-19, vaccine safety and effectiveness, and to talk about how to find a vaccination site near you, with the goal that all parents and caregivers ultimately can make a well-informed decision about getting their children vaccinated. As we all know, COVID has been really devastating for all racial and ethnic minority and American Indian and Alaska Native communities. Over the course of the pandemic, according to national data sets, African Americans, Latinos, and American Indians and Alaska Natives have been hospitalized 2 to 3 times more than whites and have been approximately 2 times more likely to die. These differences or disparities also have been experienced by our children. As an African American, Latino, and American Indian and Alaska Native children and teenagers 0 to 17 years of age have been hospitalized with COVID-19 infection over 2 times more than white children and teenagers. And as was mentioned by Dr. Fauci and others already, while we've been awaiting a safe and effective vaccine for our youngest children, almost 500 children under 5 years of age of all races and ethnicities have died due to COVID-19. Now, my heart goes out to those families that have lost a child due to COVID-19 infection, because that has a really profound and lasting impact within a family. And it's because of this history of hospitalizations and deaths experienced by children across the nation that today we can celebrate the great news that there is a free COVID-19 vaccine that's available that can help prevent severe illness for our children, including our youngest. The vaccine is free to everyone in the United States, regardless of income, insurance status, or immigration status. Now, protecting our children against COVID-19 also protects our other family members, which I have seen up close and personal within my own family. Before vaccines were authorized for adults or children, my preschool family member got COVID-19. She bounced back relatively quickly, but that was not the case for her mother, who was hospitalized with pneumonia and required at-home oxygen for 3 months. Unfortunately, my family's experience is not unique. When a child has COVID-19 infection, other health and social factors can lead to serious illness for other family members or even significant financial impacts. And I'm referring to factors such as our access to quality health care, whether we have a chronic illness, whether we live as multi-generational families and with both our children and our elders, and whether we have jobs providing sick care, just to name a few. So for these reasons and more, I am a champion for COVID-19 vaccination for children, as a pediatrician, as a public health professional, and maybe most importantly, as a family member who has been personally impacted. Throughout the pandemic, many community-based individuals and organizations have served as trusted messengers, and you've heard that term already used. And these trusted messengers have been sharing accurate COVID-19 information in a way that aligns with our cultures and the languages that we speak. The Office of Minority Health has funded trusted messengers, such as the National COVID-19 Resiliency Network and over 70 local governments partnering with community-based organizations to share accurate culturally and linguistically appropriate COVID-19 information with racial, ethnic minority, and American Indian and Alaska Native communities across the nation. With the recent authorization of the COVID-19 vaccine for our youngest children, our OMH awardees are ramping up updated COVID-19 vaccine messaging. I also want to pause and thank the community-based organizations and media present today, for you too serve as critical trusted messengers and bridges for accurate, culturally and linguistically appropriate COVID-19 information for the communities that you serve. Your role has been and continues to be essential to get the messages out about COVID-19 vaccination being a safe and effective tool to protect our children and our families, and to help reduce the devastating effects of COVID-19 within our communities. While it's already been said by my colleagues, it bears repeating that parents and caregivers can contact their pediatrician or family medicine physician or other healthcare provider, their local health department or federally qualified health center or tribal health center. They can text their zip code to 438829, and I'll repeat that again, 438829, or they can go to the website, www.vaccines.gov, to identify a nearby COVID-19 vaccination site for children of all ages and for adults also. Thank you so much again for continuing to spread the message of the importance of vaccination in our battle against COVID-19. And I'll send it back to you, Dr. Webb.
Thank you so much, Dr. Collins. And so, our last speaker today, before we turn to some of your questions, is going to be Dr. Moira Szilagyi. Dr. Szilagyi is a primary care pediatrician, an educator, and a professor of pediatrics at UCLA since 2014, where she's the division chief of developmental behavioral pediatrics and the Peter Shapiro term chair for the promotion of child developmental and behavioral health. She's worked closely with the American Academy of Pediatrics for 3 decades and currently as its president. So she's in a unique position to bring us the consensus opinion of our country's pediatric community. Dr. Szilagyi, over to you.
Thank you, Dr. Webb. Good afternoon, everyone. Well, the wait is finally over, and I'm so happy to be with you to discuss this important milestone and what it means for the estimated 18 million young children who are now eligible to get vaccinated against the virus. We've successfully immunized millions of children and adolescents to protect them from COVID-19. And the families with infants and toddlers need and deserve the same chance to protect their children against this virus. The vaccination program for the youngest has been up and running for a week now. And while the vaccines have been rolling out, the questions have been rolling in. Understandably, parents want to know why and whether they should vaccinate their children under age 5. The answers are clear. Since the onset of the pandemic, more than 13.6 million children have tested positive for COVID-19. And while infection is generally not as severe as it is in adults, young children, as has already been pointed out, can get extremely sick with the virus. Thousands of children under 5 have been hospitalized, admitted to intensive care, or suffered long-term effects. And as already noted, about 500 children under age 5 have died from this virus. We don't yet know the long-term impact of getting sick with COVID in this age group, but we do know that the vaccine helps to protect children against the unknowns and reduce the chances of severe infection and of sequelae of the virus, such as long COVID, in which symptoms can be severe and unpredictable. Millions of children have been vaccinated, and the efficacy and safety data are extremely reassuring. The vaccine works well to protect children from the worst effects of the disease, including MIS-C. This is why the AAP strongly recommends the vaccine for everyone who is eligible, including boosters for those ages 5 and older. Unlike the illness caused by the virus itself, the COVID vaccine has been proven safe in all age groups for which it has been authorized. Most side effects to the vaccines are minor. They show up within a day or two of the vaccination. They teach the immune system to fight germs. They don't stay in the body very long at all. The bottom line is we still have a high level of transmission and new cases in children, and it's far riskier for children to get the COVID-19 infection than it is to get a safe and effective COVID-19 vaccine. As a pediatrician and a grandmother, I've been eagerly awaiting this protection for our youngest children. I've practiced pediatrics for over 30 years and know well the power of vaccines to stop the spread of disease and prevent needless suffering. The COVID-19 vaccines have been carefully studied in children this age, and these studies have not identified any significant safety concerns beyond the same side effects seen with other routine childhood vaccines. Some redness and swelling at the vaccination site, maybe a little bit of fussiness and irritability for half a day to a day and a half, and some low-grade fever. My grandchildren are vaccinated, and I'm counseling parents in my practice to vaccinate their children. So now families have the same chance to protect infants and toddlers against this virus and ease the stress of navigating a world full of potential COVID-19 exposures. Those exposures have taken a toll on all of us in the last several years, and particularly on those with young children at home. It has disrupted family routines and the access to school and childcare. And it has also had an impact, a negative impact on their mental health and well-being. So we recommend at the AAP COVID-19 vaccination for all children 6 months of age and older who do not have contraindications. And we want them to use a vaccine that's authorized for use for their age. We're encouraging all states to work with pediatric practices and others to make access to the vaccine as easy as possible. Our AAP parenting site, healthychildren.org, contains news and information about these new COVID vaccines. And of course, we encourage parents and caregivers to bring their questions to their pediatricians, because we pediatricians are eager and ready to have these conversations and get children vaccinated. Thank you so much for all you do to spread the word and to help us get reliable information out to the public. And thank you for the opportunity to speak with you today. I look forward to answering your questions, and I'll hand this back to Dr. Webb.
Thank you very much, Dr. Szilagyi. We appreciate you being here and also bringing us that message from America's pediatricians. It's such an important one. Now, before we turn over to the question and answer period, I'd like to take just a moment to show you all a public service announcement created by the We Can Do This campaign. And this is being made available to anyone and everyone who can either share it via social media or even better, air it on a television or radio spot. It's available in English and in Spanish. However, you can add captions in any language. And you can also look in the chat to find out how to download a video file or request the broadcast quality version of the TV or radio PSA, and also the script for translation. Let's go ahead and watch the PSA now.
Change my life. I promise I'll be there for you, there for you. I'll pick you up where you found, so you won't have to stay alone. You won't have to stay alone.
All right, well, that was super. Hopefully it brought a smile to your faces, just like it brought to mine. Again, check the chat to see how to download or request a broadcast quality version to air as a public service announcement. So next, I'd like to go ahead and ask all of our leaders to return to the camera, and we'll start our question and answer period. I'm glad to see we've had a few questions come in while we were talking. And please let me remind you all to submit any questions in the Q&A section in English, and we'll try our best to get to quite a few of them. So with that, we'll go ahead and jump in to the questions. The first one I have is, what is our current understanding of the potential relationship between COVID-19 infection and diabetes, especially diabetes in children? Do we have any information on vaccine efficacy at reducing long-term sequelae. I'll start with you, Dr. Fauci, and see if you have anything you want to add, and also Dr. Chatham-Stevens, if you'd like to chime in.
Well, we do know, Dr. Webb, that it's very clear that when you look at the risk of severity of COVID infection, it is clearly much more severe in those who have diabetes, either type 1 or type 2 diabetes. The effective vaccine in preventing COVID-19 obviously would have the effect of diminishing the likelihood that someone with diabetes or diabetes type 1 or type 2 would get infected, and if not infected, then not get a severe outcome. But if you look at the list of all of those underlying conditions which lead to a severe outcome, clearly diabetes is among them.
Absolutely. Dr. Chatham-Stevens, anything you wanted to add there?
Nothing to add. Thank you.
All right. Well, let's keep going because we've got plenty of questions to work through. The next one is a question about access. Someone says they've called several pediatricians in their area and they didn't have the vaccine anymore. They had it several months ago for 5-year-olds, but not offering it now. Why do fewer pediatricians offer the vaccine currently for these youngest or the younger, now newly eligible children? I'll start with Dr. Szilagyi. Any sense there on kind of pediatricians' use or uptake or making these vaccines available?
As far as we haven't really heard too much about shortages at the national level. I do think that there may be some local issues with distribution in certain areas. Pediatricians who committed to providing the vaccine to their patients are still committed to providing the vaccine to their patients. There are some pediatricians, particularly in smaller rural areas, that have more difficulty maintaining a supply. And so I don't know if that's part of the issue. So that's what I know.
No, and I was going to say, Dr. Chatham-Stevens, you might also have some thoughts on that because of your work at CDC.
Sure, of course, and agree with Dr. Szilagyi's comments. I think, there was, with each of these vaccine rollouts, in the initial days to weeks, there's a lot of interest and a lot of folks go out and get themselves or their children vaccinated. And then we typically see that uptake slow down over the following weeks to months. And I think we're seeing that with the 5 to 11 vaccine. And so some pediatricians, as Dr. Szilagyi mentioned, may not just be stocking it nearly as frequently as they were earlier in that particular vaccine campaign. But would also just want to reiterate that folks can look at vaccines.gov to see what other types of providers may have the vaccine available in your community. We definitely understand that a lot of people want to go to their trusted healthcare provider. So we're not trying to discount that, but if your trusted healthcare provider, your pediatrician, your family practice doctor doesn't have the vaccine, then check vaccines.gov, call other providers, call some of the pharmacies in your area, as well as your local health department. For example, my local health department is fantastic in terms of highlighting some of the clinics and pharmacies in the area that have this particular vaccine available.
Awesome. Well, thank you so much for that. This next one, I'll start with Dr. Collins. The question is, what is the best way for individuals with limited English proficiency to obtain COVID-19 vaccination for their children? What can the average person do to encourage, and also what can the average person do to encourage family or friends to get their children vaccinated for COVID-19? It's kind of a language access piece, as well as any thoughts on what someone can do to encourage family and friends.
Well, Dr. Webb, equity is critical in our fight against COVID-19, and that includes being able to reach our children and other community members with limited English proficiency. Similar to some of the comments of my colleagues here, I would always say start first with your healthcare provider that you're already working with, that probably is providing services in a culturally, linguistically appropriate manner. So start there first with pediatrician, family practice physician, other providers. After that, or if you don't have a primary care provider, I would think about your local health department. Local health departments have really stepped up in a big way in terms of being aware of the language needs within their communities and providing either vaccines directly or referrals based on language needs. So that would be my second stop. They're federally qualified health centers. So if you have an FQHC or just a general health center in your area, check them out because they are historically very good in providing culturally and linguistically appropriate services. And you can find that by going to findahealthcenter.hrsa.gov. And then last but certainly not least, don't forget about your extended network of family and friends who may speak your same language and find out what they've done with regard to finding vaccine. With regard to just how can you encourage people in general, my key message is to remember that we are all trusted messengers. And so you can share your personal experience, make sure you have up-to-date and accurate information from the We Can Do It campaign, from CDC, from your local health department, and direct people to those accurate sources so that they can make an informed decision.
Thank you so much. Our next question is for Dr. Fauci. Do we have any information about the threat of reinfection? Specifically, is there an increased chance of severe outcomes, either acute or chronic, after reinfection? And what concerns should parents have about repeated exposures and infections in school settings? And of course, we've seen data that suggests that a large percentage of children have already been exposed to or had COVID-19. So what are your thoughts, or what's the science telling us there?
Well, Dr. Webb, it's very clear that reinfections do occur. We have experience from other countries such as South Africa and Israel and England, but also in our own country, where people who've been infected with one variant, when you have the evolution of another variant, there is a possibility of getting reinfected, even if you were vaccinated. The issue is that the experience has been that upon reinfection, the severity of the second infection is very muted compared to the first, very likely because of the underlying degree of immune response that you've generated with a prior vaccine and or a prior infection. But I think we must realize that reinfections do occur, particularly in the Omicron era, where it is a highly transmissible virus, very different from the original ancestral strains that we experienced in the beginning of 2020. The Omicron era is a bit different. Again, another reason, given the infectivity and the transmissibility of the Omicron variant, why it's so important to listen to the messages which we're all giving here today about getting our children vaccinated.
Definitely. This next question I'll put over to Dr. Szilagyi, and I'm sure it's one that you've heard many times. Some parents have said that they feel the vaccine was rolled out too quickly for kids under 5. How long did this process take from research, testing, and approval? And was this quicker than the prior adult vaccines? And so any thoughts on kind of the speed with which vaccines are put out there? It's kind of interesting because we often hear that question the other way around, and we say this took a little bit longer for kids. But what would you say to parents who are worried about the speed with which these vaccines are rolled out?
Well, I think the very first thing I would say is that these vaccines have been extremely well researched. They've actually been in development, I think, since the 1970s, trying to develop an mRNA vaccine. And it was when they finally figured out how to wrap an mRNA particle inside a fatty sheath and get it into cells that they made a huge leap in the technology. And just like any other vaccine, we always start vaccine trials in adults first, and then work our way down the age groups. They've gone through the same randomized controlled trial process on hundreds and thousands of children as our prior vaccinations have. I think that the technology has actually been a minor miracle, or maybe a major miracle, and that we should probably be very grateful to our pharmaceutical companies and all the scientists over decades that provided the evidence and the research for the development of these vaccines. They've been adequately studied in terms of safety and efficacy. We know that they only have minimal side effects and that they are very effective in preventing what they were designed to do, which is to prevent severe disease, hospitalization, and death. So thank you.
Absolutely. And one thing, and I mentioned a little bit on how it took a little bit longer for these vaccines to finally get to the youngest kids, But keep in mind, it's because of the rigor of that FDA process to ensure safety and efficacy. This is a dose that's, it's about a tenth of the dose for adults in terms of the Pfizer vaccine, about a quarter of the dose for adults for the Moderna vaccine. And those specific doses were tested for kids under 5. And that's why this process took until, June that we're rolling this out for these youngest kids, thousands of kids studied. So again, it was a longer process because we wanted to make sure that we did it right. We have time for just a couple more quick questions, and so we'll try to get to them quickly. This one is for Dr. Collins, kind of building on the prior question about language access. How will Spanish language information in pediatric vaccines be made available to harder to reach communities in the Latinx community? And how will this impact agencies, or how will this impact agencies will continue to build in this community? So how are they going to help build agency in the communities to get these vaccines out? So kind of building on the prior question, really thinking about how we're actually going to get these vaccines to these communities.
So I think we're going back to the same message of trusted messengers, and those trusted messengers are so important. And so there are two factors here. One factor is making sure that we have accurate information that's available in Spanish and in multiple other languages, so that there's information that people can read and can share with one another, and then getting that information into the hands of trusted messengers who can share it, who can explain, answer questions, and can then direct those that are from the Latino community or other communities to vaccination sites. And that's why we're here. We see this group, this audience, as trusted messengers that can now go to the We Can Do It website, that can go to the CDC website, that can take what we've shared today and then spread it throughout your communities so that we can all children, and older children, younger children, and adults can get protected by the COVID-19 vaccine.
Absolutely. And share the facts, right? It's so important that we get folks trusted information. There's a lot of misinformation out there. So thank you so much, Dr. Collins, for that. Last two questions. First one will go to Dr. Chad Stevens. Will CDC guidelines for preschools and daycares change when exposure happens in a classroom? Will vaccinated kids under 5 who are exposed and have no symptoms not be recommended for quarantine similar to adults? So any thoughts on the CDC guidelines there?
Sure, of course. Thanks for that. So these guidelines for K through 12 schools and early care and education sites were last updated in late May. And we can share the link in the chat if that would be helpful. But it does have a section on quarantine, and it recommends that people who have come into close contact with someone with COVID-19 should follow the recommendations, the general CDC recommendations on quarantine and isolation, including folks in K through 12 schools and childcare programs. It does mention K through 12 schools can consider using test to stay, which can keep those who would otherwise need to quarantine in-person learning. But it also does highlight that these test to stay strategies have not yet been evaluated in ECE or childcare programs. But it does highlight, once again, that that's an important consideration for schools to take into account. So once again, I'll post that in the chat in case it's helpful for further reference.
Awesome. And I know I'm moving quickly, but I wanted to get to this one final question for Dr. Fauci because I think it's an important one. With variants continuing to arise, what would you say to a parent questioning if they should wait for a more current shot to vaccinate their children, either an Omicron-specific booster, a nasal vaccine more effective at preventing infection, or a pan-coronavirus vaccine like those currently being developed? What would you say to them now that these are available?
Well, there's a certain rule, as you know, Dr. Webb, in vaccinology, is that when you have a vaccine in hand, use it, particularly when you're having an outbreak. And that's exactly what's going on right now. If you look at the numbers that I mentioned in my opening remarks, we're having over 100,000 cases a day and 300 deaths. Now is not the time to wait. We have a very highly effective and safe vaccine for children in that age group. The most important thing for us to do is utilize it. We'll worry about different variants as we go into the future. But right now, we need to protect our children immediately.
That's right. I mean, with the impact this virus has had, we want to make sure our children can get to that future. We want to keep people as safe as possible today. So thank you so much, Dr. Fauci. I apologize. I see there's a couple questions left, but I know that's all the time we have for questions today. If you do have additional questions or we can get back to you, please feel free to contact Kate Mueller, whose email was in the media advisory and also in the chat area. But I just want to go ahead and thank our spokespeople today for their time and the helpful information they were able to provide in this conversation. And I'd also very much like to thank you all for joining, for attending, and for engaging. This is so important to put you in a position where you're more able to do what you can to get the word out in your communities about the next steps in meeting this pandemic and rising to this occasion and helping us move forward to a better place as a nation in the weeks and months ahead. So thank you for your time and for your engagement. And as always, stay safe out there. You all take care.
Thank you.